Assalamu alaikum, Iyakan Abdu, Iyakan Astain. Welcome to my channel, Dr. Shami says. So, in today's video, I am gonna go through the Surgery 23rd August morning paper. So, let's start. Which of the following act by phospholipase, that is oxytocin? The patient whose positive anterior drawer sign with leg pulled anteriorly is seen clinically in the knee joint when there is the anterior cruciate ligament injury. Next, the patient with the injury to the neck of the fibula and there is a loss of dorsiflexion and the sensation on the lateral dorsum due to the damage of the deep peroneal nerve. If the foot is permanently dorsiflexed and the everted, which nerve is most likely damaged? That is the tibial nerve. The mastectomy of the patient done and the muscle was damaged. After that, the patient can adduct and extend and internally rotate the arm. Which muscle is damaged? That is the latissimus dorsi. Next, after RTA, there is injury to the axilla and the loss of sensation of the lateral arm. Nerve damage would be the axillary nerve. The lymphatic drainage of the breast upper outer quadrant is the anterior axillary, which is the site of the tracheostomy in the adults. That is definitely the C2 rings. C2. Next, the prolonged cell death is related to the apoptosis. Ovarian CA tumor marker is the CA125. The patient with the abscess in the posterior triangular neck which was operated. Now patient cannot comb her hair. The lesion is in the median nerve. That can't be median nerve, sorry, that is the spinal accessory nerve. The nutmeg liver cause is the chronic congestion. The palpation of the artery at the TMG is the facial artery. The boxes hit on the face, temporomandibular joint damage. Now mouth remains in open position. What muscles keep in this position? That is the lateral pterygoid. The which of the following structure pass through the foramen ovale? That is the mandibular nerve. Next, the stab injury to the anterior thigh leading to the loss of the knee jerk and the medial thigh sensation lost. Nerve involved would be the femoral nerve. The woman with the history of the trauma of the head and neck region having the lesion of the tongue on the protrusion of tongue deviate to the left side of the nerve. Most likely injury would be the left hypoglossal. Young lady had aphasia due to the lesion of Engler iris. It will cause the anomic aphasia. The 45-year-old female presents with the bone pain and the paresthesias in the lower limbs. Her laboratory investigation was done, showed the serum calcium of 2.60, inorganic phosphate 0.9, and the ALP 385 and the serum PTH were borderline raised. What is the most likely diagnosis? That is going to be the primary hyperparathyroidism. The patient has the muscle tightening contraction on the first post-op day of the thyroidectomy. This is due to the hypocalcemic tetany. Which hormone is mainly released earlier in the stress? That is the CRH. The structure prone to the damage in the quadrangular space would be the posterior circumflex femoral artery. The hyperextension of the neck is limited by which of the following? The anterior longitudinal ligament. What joins one lamina to the upper lamina of the vertebra? There is a ligamentum flavum. The lady with the CRF patient sample taken which was placed in the refrigerator overnight. Next is the normal sodium raise, potassium raise, phosphate and the LDH. What is the cause? There is hemolysis. The blood sample the patient with the pH of 7.12, partial common size 60 and the bicarbonate 19. The cause is the mixed metabolic acidosis and fatty acidosis. The patient brought to the ER unconscious. There is the breathing problem. Empty bottle of the aspirin found. How antidote will act? There is increased tubular excretion of the aspirin. Next, the artery present at the base of the pyramids is the arcuate artery. Hereditary spherocytosis defective protein is which of the following? That is expected. The first initial management for the DKA is the IV insulin in the normal line. The squamous cell carcinoma occurs in which part of the lung? Central part of the right and left bronchus. The person with the skin pigmentation, central obesity, came in the follow-up evaluation. He has the HDL level report that shows in the decline pattern after dexamethasone test, which causes the Cushing syndrome. What will be shown in the PA view after barium meal and the patient has esophageal constriction of aorta. Arch of aorta. In the summer, the fasting men have concentrated urine due to the increased areas which represent inflammation is in the patient appendicitis with the pus cells in it. That is a suppurative. The inherited only from the mother to the child is the mitochondrial DNA. The hydrocarbon was given. This will work as initiated in the process. The initiator work as the permanent DNA damage. The patient the history of the third degree swear burn causing damage the spinosum granulosum, the basilis effect would be the cutaneous water loss. The healing of the clean wound structure by the doctor characterized as the scar. Hysterectomy is performed through transverse suprapubic incision known as the fenestral incision. The patient presented with the chronic fever, night sweats and the cervical lymphadenopathy. The Chest X-ray shows the diffuse nodular opacities. The diagnosis is the TB. The patient presents the jaw claudication, headache, and examination, temporal artery firm, and there is a biopsy which is associated with there is a giant cell arteritis. In which of the following AFP and the beta SCG is raised? There is a embryonal carcinoma. Gene mutation, the female leading the CA ovary. Which other organ at the risk of developing carcinoma of the breast? Patient having the hypoxia, perspiration oxygen made is 65. The type of hypoxia is the hypoxic hypoxia. The middle age known and stage renal disease. List for the hemodialysis. Multiple transfusion done. Pneumostic anemia. What is the most appropriate therapy? That is the subcut erythropoietin. Regarding osmosis or osmolality represent number of the solid particles. Anesthetic agent that dissociate in the light is the halothane, which ion is raised in the malignant hypothermia, that is the calcium. The patient is diabetic and the conscious for the weight loss on antidiabetic. Which drug she is using? The metformin. The strenuous strenuous exercise increased ventilation is due to the collateral stimulation from the heart center. The patient presents the hemoptysis. Which one is affected? That is the left gastric vein. The carcinoma is usually very lethal and incurable. Which of the following is curable carcinoma? The gastric adenocarcinoma. The EBV infect which of these cell? The beta lymphocytes. The patient climbed a peak with a heavy bag on his shoulder. After that, he developed the loss of adduction of the arm with loss of flexion at the elbow, loss of extension of the wrist. Most likely damage occurs to which of the following? There is the upper part of the brachial plexus. Injury results in the damage of anatomical snuff box. Unable to move thumb, unable to abduct the wrist. Which muscle is of the extensor compartment damaged on the lateral side? That is the extensor pulsus brevis. The patient with the inability to tight the screw and there is a loss of supination muscle damage would be bicep brachii. The thalamus does not receive which stimuli the sense of olfaction. The childhood tumor with the gene amplification is the neuroblastoma. The melanoma invade the orbital cavity through which of the following? That is the medullary veins. The patient had the RTA, does not know recent events, but he remembers his school events. Where is the lesion? That is the hippocampus. Which of the following is locally malignant tumor? There is ameloblastoma. The 40-year-old female with a heavy bleeding since 6 months on and off. Endometrial biopsy shows the endometrial hyperplasia. Cause would be the estrogen. The change in the size, shape, and the polarity is called the dysplasia. The pap smear of the lady done, which shows the dysplasia increase sedation, the polymorphism, but basement membrane is intact, which is associated with the carcinoma in situ. Athletes have the enlarged size comparatively and increased stroke volume instead of their muscles need same amount of energy and having the cardiac approximately same as that in the normal individuals. What can be the reason for this phenomena? That is the decrease heart rate and increase SV, the fenestrated capillaries in the kidney. The girl has a bronchial obstruction, but alveoli are still irritated due to the alveolus pores. Which of the following is a potassium sparing diuretic? That is the amiloride. 35-year-old old gravida is in the labor at the 40th week of gestation. Vaginal exam reveals the cervical dilatation. 6 cm fetal presentation is phallic at the 0 station. Which of the following landmark is taken as the reference to the 0 station? That is the ischial spine. The patient presented with the RSC pandermatome for the cholecystitis include the T7 T9. Multigravida female, the third degree prolapse. Which ligament will be damaged? That is the uterosacral ligament. Next, the inferior mesenteric artery is ligated. Which of the part of the large intestine is affected? That is the descending and the sigmoid colon. Thirst is increased, but the increase in angiotensin 2. And the patient having the fever cough with the sputum infiltrated on X-ray chest, gram positive catalyst, an active organism was rated in the culture would just have pneumonia. The witness of Staph aureus strain measured by the ocular participant temperature lost carried by which of the following tract? That is the lateral spinothalamic tract. The worker is being working near the nickel metal shop. Which carcinoma is being predisposed likely? That is the lung CA. The female patient present the increased frequency and urgency was diagnosed as UTI. The case microscopy shows the gram-negative motile rods. It is positive lactose non-fermenting on the McKenkie agar. Likely organism involved would be the Proteus mirabilis. Next, the mechanic presence with the urethritis and the dysuria. The most likely causative agent would be the chlamydia. The squamous carcinoma diagnosed in the person who came from the Dubai and presented with the painless immature. Likely organism associated with the disease is the schistous myomatomy. The patient present the diarrhea, urticaria, and the thrombocytopenia and altered mental status and also have the raised creatinine with the raised unconjugated bilirubin. Cause is the TTP. Next. 83. The patient presents the fever, decreased blood and bloody diarrhea. Peripheral film shows the schistocyte. What is likely cause? The hemolytic uremic syndrome. Patient the awake abdominal pain, the nausea, pain was not related to any meal, no cardiac issues. Glucose normal endoscopy was done, which showed the normal stomach with no mass or ulcer. It was found non-ulcer gastritis. What is the cause? Pernicious pneumonia, ascending cholangio Hepatitis is caused by the coronavirus sinuses. The brain tumor most commonly after the radiation is the meningioma. The child with the blue skin and multiple fractures, his uncle suffered from same condition. Diagnosis is the osteogenesis imperfecta. The middle of the bone is the hydroxyapatite. A 2-year-old baby brought by the mother. She said there is a transient decrease of blood sugar and hepatomegaly. Then diagnosed as the 1 gig disease. The doctor advised increase intake of the carbs. Next, which of the following vitamin is deficient after acute pancreatitis? That is vitamin D. The patient presents the bleeding from the post-duodenal ulcer, rupture of which of the following artery, that is gastroduodenal artery. The patient came with epigastric pain, heartburn, endoscopic perforation of first part of the duodenum. First in which artery is eroding the duodenal ulcer, that is gastroduodenal artery. That Bernard Solier is the characteristic. The platelets don't aggregate in response to the Risto-Cetin test. Next, epiximag mechanism of action is the block glycoprotein 2b3. The injury to the medial cord, the brachial plexus, weakness in the flexion nerve involved would be the musculocutaneous nerve. In case of the corneobacterial diphtheria, which type of the growth pattern is in the Graham staining, the palisade pattern. The significant increase in the blood viscosity is seen in the dehydration. Majority part of the blood composite is in the form of the bicarbonates. Next, the brain blood flow increased due to the increased participation of composite. If there are 250 hypertension in the population of 1050 new added, what will be the initial prevalence? That is 250 per 1000. Old lady admitted for the 2 weeks for the femur fracture. She had the pain and the tender palpation, then suddenly dyspnea, which will be the further complication leading to this. There will be thromboembolism. The posterior one third of the interventricular septum artery accompanies which vein? That is the middle cardiac vein. That is the girl presented the physician with the concern both her mother and sister died of the metastatic breast cancer. For 40 years, she is worried about herself, which of the following gene is mutated in this case? That is the BRCA1 mutation. What is aneuploidy? Chromosomal numeral aberrations like monosomy and the trisomy. A 20-year-old second-year medical student develops a red face after being asked a question in the lecture, which is the following statement best describes the vascular reaction, the active hyperemia. The person with the water deprivation, which hormone will increase the ADH, which while doing the surgery, splenic vessel need to be ligated. There are present in which ligament? That is the Leonardo ligament. The farmer present with the red granules draining abscess from the foot organism responsible would be the actinomedulla. 109 the patient develops the fatigue and the pallor. On CBC, she has MC115, MCSC30. On inquiry, the patient told that there is a past that in the past she undergone gastrectomy 1 year back. Treatment option would be the injection of vitamin B12. Chronic alcoholics suffering from the liver cirrhosis develop the portal hypertension in the capita medusa. In this condition, the veins around the umbilicus are connected to the left branch of the portal vein through the perimbilical veins. The 60-year-old lady presented with the fracture of the hip bone, which supplement might be beneficial for the lady. The egocalcifer, the part of the pituitary gland at the infundibulum, is called the pars tuberans. The patient presented the fever, vomiting, abdominal pain. On examination, there is a guarding of the abdomen. Likely diagnosis would be the enteric fever with the perforation. The person running the marathon race, blood flow, the non-exercising muscle is by the postganglionic pathologic in granulocytosis, at which stage granules start to appear that resemble mature myeloid cells, the promyelocytes. The patient presented the ER after RT spleen was ruptured, splenomegaly was done. What will be the finding? There is the whole jowl body. The child presented the suprapubic swelling with get wet. Mostly in the child has epispadias. Pubic bone deformity. What is the cause? That is the incomplete caudal closure of the cloacal membrane. Next, 118. The young man had a road side accident in which he suffered from spinal cord injury. Some soft filling located in the center of the disc of the spinal cord known as the nucleus pulposus. It is derived from which structure? There is a notochord. The big ganglionic supply, the adrenal gland, is by the greater thoracic spinal nerve. The wave during the algebra arithmetic means solving which wave appear, that is the beta wave. After fatty food intake, digestion required which of the following hormone? That is the CCK. 40-60% of the genetic defects are the multifactorial ganglionic sympathetic fibers or the white ramize. Next, 1 to 4. The most common cause for the formation of the deep venous thrombosis is the prolonged embolization. Pregnant lady has increased blood flow with the normal size baby. The cause is the duodenal atresia. 1 to 6. For the prenatal diagnosis, genetic abnormalities, best test done would be the chorionic villus sampling. 1 to 7. The patient dysphagia, severe chest pain, difficult belching, and the air flood level. ECG looks normal. Cardiac enzymes normal. This is likely due to the ecdysia. Child with the eczema recurrent despite tract infections with a low platelet count. That is the Viscott Eldridge syndrome. The hormones responsible for the glycogenesis in the ketogenesis would be the glucagon. The woman doing the robbing resists multiple stab wound on the right side face brought to the emergency after primary care. Doctor notes right facial nerve damage, but muscle would be paralyzed. That is the posterior belly of the gastric. Female patient pale lethargic, does not took any antinetic during the during delivery, bleed a lot. Nutrition deficiency in both the baby and the mother would be the iron. What should be the pharmaceutical and doctor interaction purpose should be entertained for the patient's benefits. The female patient comes to the doctor clinic wearing revealing clothes. She comes up with very close to the doctor and starts asking the person questions in a seductive tone. What will the appropriate response by the doctor? The call in another. The primitive streak, ectoderm, and the endoderm meet at the cloacal membrane. Apex of the heart blood supply is the left anterior descending artery. The patient was taking warfarin and after monitoring INR 2-3 in the normal range, but then patient took another drug for the chest infection due to which INR increased to 5. What is the drug? There is the clarithromycin. CCl2 was given to rat in the laboratory, but leads to the 2,1,4,25 dihydroxycholecalciferol. Next, the spermatogenesis complete in how much period? There is 60 days. Man stand from sitting position which reflects involve, that is the flexor reflex Marfan syndrome. Defective protein would be the fibrin. The patient was taking aspirin advice. The cardiologist surgeons want to operate on the inguinal hernia. How many days prior to surgery aspirin should be stopped? It should be stopped 7 to 9 days prior to the surgery. 1 liter normal saline given the patient. What will be effective on the urine? The body associated with which cell type? That is the neutrophils. The patient had the respiratory symptoms and had the lymphatics, blood vessels in the epithelial granuloma without necrosis. Diagnosis is the sarcoidosis. The LED CRF blood sample taken and put in the refrigerator the next morning. Results are sodium 140, potassium 6, LDH 6, and creatinine raised. This is due to the hemolytic reaction of the blood sample during thoracocentesis. Sample taken at the 9th ICS. Risk of damage to which structure is the 9th into question of child previously having the TB comes to you with the complaint of fever in the cough along with the noisy breathing and difficulty in the swallowing. No diagnosis. The retropharyngeal abscess. Which structure it will invade? First, the prevertebral fascia. Patient has given injection penicillin, after which he develops shortness of breath, constriction, which should be immediate drug to the given to the patient. That is adrenaline. The skin deossification presence in the epiphysis. The 45-year-old man with a long history of the alcoholism presents with the severe epigastric pain, nausea, vomiting, fever, increase in the serum amylase. Diagnosis of the acute pancreatitis superimposed the chronic pancreatitis was made in this condition, which is the following. Type necrosis is the most characteristic. Fatty necrosis most lethal. After the liver transplant is the CMV. The boy fell by his left shoulder and then his arm is hanging and elbow is extended with the arm. Medial rotation pronatory to the damage of the upper trunk of the brachial plexus. The 14-year-old boy with the fluctuating type of the deafness. On examination, the penny detected inward renal test is negative. Weber lateralized affected ear. The probable diagnosis of the stitching tube blockage. The regarding blood supply of the bones at the ends of the long bone supplied by the epiphyseal arteries in aggressive and the disturbed child. Drug given would be the haloperidol. Lady cut her finger by the knife while working in the kitchen. What mechanism her vasomotor response increase? That is the postganglionic C fibers. Increase in the cerebrospinal fluid circulation due to the impaired absorption is most commonly associated with the fault in which of the following structures? That is the arachnoid granulations. The Friedlander pneumonia is primarily caused by which of the following pathogens? That is the Klebsiella pneumonia toxin produced in the scarlet fever or basically the erythrogenic toxins. The patient presents the mass in the mandibular region in the facial attribution which of the following viruses is most commonly associated with this? Epstein-Barr virus. High concentration of epinephrine primarily exert which of the following affects the glucose metabolism? The stimulate gluconeogenesis, stimulate glycogenolysis. The patient with the cirrhosis presents the acquired bleeding abnormality which of the following laboratory findings most consistent with the condition of prolonged prothrombin time? The dancer moves smoothly and rhythmically in the sync with the music. Which function of the motor cortex primarily responsible for the performance? That is the planning and the execution of the movement. The patient present with the megaloblastic anemia. Investigation, there is a urtic acid in the urine leads to what is this acid? There must be something mistyped here. Increase the sensitivity of which of the following? The pyrimidine. The prospective cohort study involved taking exposed and non-exposed groups over time to measure the development of the disease. 166. The patient with the spinal cord injury at the T6 present with the severe hypertension. pounding headache and the sweating above the level of the ligand, which is the most likely cause of the symptom. That is autonomic dysreflexia. 4-year-old child presents with the testicular swelling. AFP levels were done, which were raised. So tumor was rejected after with the AFP levels dropped to the normal. Child was suffering from which tumor? That is a yolk sac tumor. The 45-year-old present the symptoms of excessive heat, production, profuse sweating. Imaging reveals the space occupying in the brain. Which area is most likely affected? In this case, the hypothalamus. The bicornuate uterus is due to failure of para-meson effect. Which of the following is the false regarding the transmission of action potential? That is, the dendrites are important contributors to the action potential. 171. At which level of spinal cord injury in the patient most likely to experience difficulty with the ventilative function due to the impairment of the respiratory muscles? That is the below C3, C5. The last but not the least, 172. In which phase is the maximum flow of the oxygen per myoglobin observed, considering its role in the muscle tissue? That is aerobic exercise phase. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.